Hello, everyone. My name is Chris Black. I work in the communications department at the World Health Organization. Normally, I'm in Geneva, but today I'm joining you remotely from another part of Switzerland, and I welcome everyone to one of our fantastic live sessions. Today, we've got a real special treat for you. We have Dr. Meg Doherty, who is the director of WHO's Global HIV, Hepatitis, and SDI programs. She's joining us from Geneva. Hello, Meg.
Hi.
Thank you so much for joining us. As many of you know, this week, the International AIDS Society had held its biannual meeting looking at HIV and the response to HIV around the world and bringing together thousands of experts on HIV and from many different disciplines, from civil society, from international NGOs, from everywhere around the world. This year was unique that the meeting was virtual. Dr. Doherty, you participated in that meeting, and I wonder if you could give us a little bit of background on the meeting itself, and more importantly, for our subject today, we're looking at HIV in its relationship with COVID-19. As many of us know, we all know actually, COVID is really affecting everyone around the world. So we have this intersection between HIV and COVID, and I'm looking forward to hearing your opinion on this. Welcome.
Thank you very much, and I'm really glad to be with you, and I'm so glad to be able to answer some questions and give you some information about this important meeting that took place. And as you said, the AIDS meeting usually happens every other year where we bring in 20,000 or more people together. It's a networking opportunity, it's an opportunity to share science, and it's an opportunity to celebrate where we are in terms of the HIV response and trying to reach the elimination of HIV as a global public health problem by 2030. So this meeting, of course, was shrouded by the fact that COVID-19 has been happening for the last 6 months, and also that we know we had to move to a virtual platform, which has been a learning experience for all of us. And I have to say, over the last 4 days, it's been a fantastic experience. We feel like we're engaging with our partners, we're communicating new science, we're sharing evidence, and we're getting feedback from around the world. So it has been a great opportunity to see how we can do these kinds of meetings differently. Some of the important things that WHO brought to the meeting would be the following. We were so lucky to have our Director General, Dr. Tedros, at the opening of the meeting, where he was able to share in the opening press briefing about a new survey that the HIV department has undertaken, which looks at the potential risk of people living with HIV having disruptions in their antiretrovirals for a period of time, and that this could actually cause more morbidity, more death, more challenges to people living with HIV than COVID itself. In our survey, we saw that 73 countries around the world reported that they were at risk of having a stock out of antiretrovirals, and among that 73, 24 had less than 3 months of stock ready to go. And so even though WHO and all of our partners, Global Fund, PEPFAR, UNAIDS, UNICEF, we're trying to support our countries and people living with HIV by asking them and asking the ministries of health and their country programs to provide them with at least 3 to 6 months of their life-saving drugs. We're seeing that worked at the beginning of the COVID epidemic, but now as this is prolonging into a longer-term challenge and problem, we're seeing that we have to do a better job of backfilling our stocks so that people can actually have their ARVs and not have interruptions. We know that if we do have an interruption from some modeling experience, that the worst case scenario, we could have deaths related to HIV that are similar to the levels of deaths we saw in sub-Saharan Africa in 2010 and 2012, when we made this global commitment to ending AIDS. So we've been discussing these issues along with some other brand new science that has come out, which I'm happy to speak about as we talk this afternoon.
Excellent. Thank you, Dr. Doherty. If we look at COVID-19, are people living with HIV more vulnerable? Are they at higher risk of getting the disease?
So this is a question that everybody's really wanting to know. And early on, we thought that potentially people could be either at higher risk or lower risk for having severe COVID. And there's a couple of reasons why. People with HIV can be immunosuppressed, and like other immunosuppression, be at more risk of having severe infections. But people with HIV, some of them are on antiretroviral drugs or drugs that work against viruses. And perhaps that drug could protect them or help them with COVID. So right now we have a couple of pieces of information and evidence now, and one of these new pieces of evidence was shared at the meeting. There was evidence coming from South Africa, which is probably the highest affected country of HIV. Many people are infected and living with HIV in Southern Africa. And they looked at all of the data from the population that goes into a computerized mortality register, we should say, or a death register, and looking across 3 million deaths. And they looked at how many of those deaths were in the last several months related to COVID. And they had about 21,000 that people who were infected with COVID, and another 600,000 that were affected with HIV as well as COVID. And they could compare, were people living with HIV at a higher risk of dying versus those people didn't have HIV. And what they could see is, yes, in that area of Southern Africa, people living with HIV had a 2 times increased risk of dying. But then again, that compares to people who have diabetes or hypertension or renal disease, and they were at a 13 times higher risk of dying. So compared to what we call the non-communicable diseases, HIV was not as much of a risk for severe disease, but there's certainly something there, and we want to make sure that people living with HIV stay on their antiretrovirals. Other studies from Spain, the United States, UK, don't show this association, but they're much smaller studies, and they're studies that have been taking place in hospitals where people are already very sick and at risk of dying or having a very poor outcome with COVID.
Thank you so much, Dr. Doherty. So if you're joining us a little bit after we started, we're looking at HIV and COVID-19 with WHO's Director of HIV, Hepatitis, STIs programs, global HIV hepatitis STI programs.
A mouthful.
It is indeed. And we are so glad you could join us today. This is a virtual live session we're doing. If you have any questions for our expert and you're on Twitter, just hit #AskWHO, #AskWHO. If you're on YouTube or Facebook, just put those questions in the comments field, and our team will pick them up and we'll ask our expert right away. If you're watching, let us know where you're watching from. That's always great to hear. And if you have any stories from your community about how you're working on HIV or how your COVID-19 is affecting you, we'd love to hear those stories. So just don't hesitate. Thank you so much in advance. Dr. Doherty, what is WHO doing to support countries to continue HIV services during the pandemic? When people are difficulty accessing health services, accessing the medicines?
It's such an important question, and we're really doing as much as we possibly can. So the first thing that we were able to do is working with our health systems team and our emergencies team, we put together a set of guidance documents that had some advice inside about which are the services that we consider critical that need to continue during the time of COVID, even if the health center or the hospital or other places are locked down. And that included staying on antiretroviral therapy, the medicines that really are life-saving for people with HIV, ensuring that people have access to viral load testing, and something we call early infant diagnosis, so that mothers who are pregnant and have HIV and give birth to a child, that we can quickly learn if that child is infected or not, because the treatment for that child is dependent on whether or not we see the virus in the child's blood. We also said that condoms should be maintained. Other services for prevention. There's medicines that can be used, like antiretroviral therapy, to prevent HIV infection. We want all of that to continue, and that was considered essential, as well as going to ANC and immunizations, because we know that maternal child health care is also essential. There were some other services like having a voluntary male medical circumcision that could be postponed for a bit of time, and then we could work towards following up with this. And another thing that we've recommended countries to do is to use HIV testing that can be taken home, or what we call self-testing, or where people can use that by picking it up in the community. And lastly, I think around the world, HIV healthcare workers, whether they're doctors, nurses, auxiliary healthcare workers, community healthcare workers, almost all of them in low and middle income countries have been working on COVID. They're helping with the testing, they're helping with contact tracing, they're helping to ensure people get their medicines by delivering the medicines out into the community networks or into what we call community depots where the medicines can be picked up. And they're really, and community itself, people who are affected and living with HIV have been supporting their peers and supporting those who need it so that they don't go without their medicines and the psychosocial support they need during this time.
Thank you so much, Dr. Doherty. You talked about mothers, you talked about communities. One thing that I saw in the news quite a bit this week was the impact on children. Can you tell us a little bit about that?
Yes, I think, well, you know, we also present every year at these meetings the new data. What's happening in terms of HIV? Are the deaths going down? Are the new infections going down? And this year we had a bit of a not so rosy picture from 2019. And this happened even before COVID hit, where our new infections stayed the same as it was in 2018. So we have about 1.7 million new HIV infections this past year, 2019, and about 690,000 deaths. And these trends are not going to get us to where we were hoping to be in terms of targets for 2020. We're off, and we're even further off for children. So generally, children have been further behind in accessing antiretrovirals in terms of reduction of death, in terms of reduction of new infections. And that means that we have to do a double effort to try to get mothers who are pregnant to get tested for HIV, and if positive, ensure that those infants have access to medicine so that they can prevent it's sort of a prophylaxis, or if they're positive, that they can get treatment very early when they're identified. Because we know with children, if we don't treat them within the first 2 years, almost half of them will die of HIV and AIDS. And that's really just a crisis and something we just can't live with, because we know what to do. It's just we're not doing what we need to do to reach these children. But there was some exciting news that we have some new medicines that can be used, something called dolutegravir that we've been using for adults around the world, that we can use in children who are less than up to 4 weeks, more than 3 kilos. And this is like brand new options where we can really try to do the best for the youngest children out there infected with HIV.
Thank you, Dr. Doherty. So our questions are pouring in. Thank you, everyone who's taking the time to ask those. We really do appreciate it. Here's a question that we got on Facebook. Besides the usual precautions that we talk about in terms of protecting oneself from COVID, hand washing, social distancing, etc., are there any specific precautions that people with HIV should take to protect themselves from the disease?
Well, I think absolutely they need to stick to those original precautions: washing your hands, washing your hands, washing your hands, masks where it's necessary and expected in your community, and also physical distancing. Don't leave those behind. But for people living with HIV, one thing is to know your status. And so there are a lot of people who don't know that they're infected. So if they have a partner who's infected, or if they think they're at risk, get a test. For people who know that they're infected, please make sure you're taking your antiretroviral therapies, because the better your immune system is, the better you'll be able to fight off infections. And third, make sure that you're virally suppressed. Take your medicines as indicated. So if you haven't had a recent viral load, if you can have a viral load, do so. If you don't have if you can't access a viral load because of lockdown, make sure you take your medicines daily, because taking your medicines daily, as your clinician indicates, will be the best protection you can have. And if you've been sick before and have what we call a low CD4 count, make sure you're also taking your medicines for preventing other opportunistic infections. That could be Bactrim or cotrimoxazole. That could be medicines to prevent cryptococcus and other infections out there. So if you have those and you're supposed to be taking them, do take them, because being well and staying free of other infections will help you. And certainly for people who are at risk of tuberculosis, there's medicines to prevent tuberculosis, and you want to be taking that as well.
Thank you, Doctor. Along those lines, we have a message on Facebook from Sejal, who says her husband, or his husband, says has had HIV since 20 years and on retroviral medicine. He just got COVID-19 but a few weeks ago. He's stable now, so that's good to hear. Thank you for that news. Is there anything to worry about having both viruses in his system?
Yeah, I think, just as I said, that what's really good news is that he's done well. Currently, we don't necessarily know individually what it will mean over the long term for being infected with both viruses. And I think the most important thing for him to do is stay healthy, have a good nutrition, take the medicines, and just if there are ongoing sequelae or ongoing issues related to COVID, to follow up with either your HIV or your general physician to make sure you check those out. There's so many things we don't know about the COVID virus. It's only been around for 6 months, whereas HIV we've known about for 40 years, and we still don't know everything we need to know about the virus. But COVID is so new, we don't know what the long-term consequences are, if you need to take medicines over the long term to stop some of those. And I would definitely communicate with your local provider to get that kind of information.
Thank you so much. Along those lines, we have a question on Twitter about the commonalities between SARS-CoV-2 and COVID and HIV viruses. I'm wondering if people who are experts on HIV are looking into that. Touched on as well in terms of the commonalities in the response and in the role of people living with HIV and people working on HIV, the things that they can give in the response to COVID. I'm wondering if you could talk about those two points for us.
Yeah, in terms of the virus itself, there are two different kinds of virus. HIV is what we call a retrovirus, and coronavirus is another set of respiratory viruses. Those viruses enter into our body in different ways and wreak havoc in different ways. HIV attaches to your immune cells, so really difficult to get a vaccine up and going because it destroys the immune system before you could even mount an immune response. So it's really a challenge. And over 40 years, we don't even have a vaccine. Whereas the coronavirus enters into your lung cells, but it travels everywhere and it seems to wreak havoc in all systems of the body. So there's not necessarily a specific link between the two viruses. And I know early on there were lots of but certain hypotheses running around on social media. I would have to say we know that these are two very different viruses, but the way we address viruses can be very similar in that we have systems where we need to assess surveillance, what we call getting data from the community to know, there's a group of people over here who seem to be sick. And that surveillance system for HIV has been mobilized in many places to be able to identify those people suffering from COVID as well. So the data systems are there. The laboratories, the HIV laboratory is set up to be able to run what we call PCRs. They look for pieces of the virus. And that's exactly what we're doing for COVID, where we're looking for pieces of the virus in that swab from the nose. And countries have been able to capitalize and use their HIV laboratories to bring in the COVID tests and run the COVID tests. Now, they're very different tests, but they use the same sort of machinery to be able to run those tests. And the healthcare workers are infectious disease people who are looking into vaccines, looking into treatment. So they're the same people who are putting all their thinking in HIV, and they're now translating it over to COVID. And one really profound example we've seen is that for the vaccine development, at least 5 different platforms for vaccines have been now repurposed for COVID vaccine. So actually they're leapfrogging, they're getting a heads up on the vaccine development because they're using what has been working or tried and developed for HIV.
Thank you so much, Doctor. So for those who are joining us a little bit late, just a reminder, we're here with Joe's expert on HIV and STIs and hepatitis and all sorts of things, Dr. Meg Doherty. And we're looking at the relationship between HIV during these COVID times. This is following on the International AIDS Society meeting, a biannual meeting, which took place this week. Dr. Doherty, we have if people are joining us a little bit late, we have a question from Ankur Thakur, who's asking quite a general question, and it'd be great for those who are just joining us. How does COVID-19 affect people living with HIV?
Thank you very much. Again, let me go back to what I was describing before. We're still in the process of identifying what's really going on between COVID and HIV, and we have lots of data that we're looking at. When we look at data that come from hospitalized studies and looking at outcomes of those who come into the hospital, whether they're HIV positive or HIV negative, there doesn't seem to be a great difference. People who are HIV positive seem to do as well or as poorly as their HIV negative counterparts. But when we look in South Africa, when they look across the entire population of a certain province in Southern Africa, and remember, in Southern Africa, you have many, many more people infected with HIV. They have seen that looking at that population, that when you look at all the deaths that are happening since February till now, that people living with HIV have a slight increased risk, 2 times increased risk of death. But people who have diabetes or uncontrolled diabetes or hypertension have almost 13 times increased risk of death. So comparatively, HIV may have an increased risk, but it's not as great as uncontrolled non-communicable diseases. And we've seen that around the world, that people who have uncontrolled non-communicable diseases, uncontrolled hypertension, uncontrolled diabetes, kidney disease, obesity, they're doing poorly with the COVID-19. And I think we'll be learning more and more about this as we gather more data around the interactions between HIV and COVID. Thank you so much,
Doctor. Dale put out a survey this week showing that, looking at access to HIV medicines, you mentioned this previously. Can you tell us a little bit more about the key findings of the survey and what measures countries are taking to ensure that people living with HIV can continue to access medicines during this period?
Okay, great. Yes, our survey went out and it was conducted. We've been conducting it regularly, and the data that we presented at the AIDS 2020 meeting was up until June 25th. And we know that this is a constantly changing environment right now as countries come out from lockdown or countries are seeking solutions. But up until the end of June, what we've seen is 73 countries from around the world reported that they had a risk of stockout of antiretrovirals that could affect potentially up to 17 million people who are taking antiretrovirals. And amongst those 73, 24 of them in particular had a low stock of less than 3 months of their antiretrovirals. And that could affect up to 8 million people taking antiretrovirals. Now, what's important about this is that we are working very hard to find out how we can move drugs around. We're speaking with the countries. When they have a stock out, we're seeking help from another country to bring in the drugs. And we're working with both suppliers and some of the big implementers to ensure that for those countries that have less than 3 months, that we're doing something to ensure that we can backfill their central pharmacy stores. WHO has recently provided medicines for at least 200 people who are living with HIV who have been stranded around the world. An NGO came to us and asked us to really solve a problem for these people who couldn't get back to their home countries. And this is happening in particular also for medicines that aren't in high demand, like pediatric medicines. They have a smaller, what we call market, meaning that there aren't as many children who need the drugs, but they need them critically when they're born. But because there's a smaller market, then the supply chain is very, very risky, let's say. The other thing that we're doing is we're really working to see in the future how we can diversify our supply chain, because this lack of access to antiretrovirals is not because the antiretrovirals aren't being made. They're just not being able to be moved around as quickly as they used to be. So we're hopeful that we'll be able to solve this quickly and move the antiretrovirals where they need to be as soon as cargo flights and other flights are running more regularly. The other thing that we've asked people living with HIV to do is, if early on, we've asked them to get at least 3 months to 6 months to be at home with, so that if they were on lockdown, they wouldn't have to run back and forth. And we've seen some excellent examples of where this has been really working well, where communities have gone and brought medicines closer to home for people, where they're bringing the medicines for hepatitis B and hepatitis C. And we hope that it'll be cyclical, that we'll be able to solve this problem. But people living with HIV know that coming off and on medicines is not ideal. We want people to stay on their medicines consistently so that they don't develop resistance and that their medicines continue to work for them.
In terms of people who have HIV and perhaps also have tuberculosis, does that put them at any more risk in terms of COVID, in terms of lots of coughing and being much more vulnerable?
Well, I think it's the same situation between the relationship between COVID and tuberculosis. There's some studies that are saying there may be an interaction and a risk. Some others that say there are not. And I think we're going to need to look at all studies over a longer period of time. But in that same study that I was discussing from Marianne Davies from South Africa, they also saw an independent but slightly lower risk among people who had active tuberculosis. But having TB and tuberculosis together did not seem to increase the risk anything differently than either having HIV alone or TB alone. So I would say, any other infections, we want to try to keep people as healthy as possible, and certainly infections in the lung. We don't know if that makes it worse for COVID, but certainly we want people to be healthy, and that's the best defense against having severe COVID at this point in time.
Yeah, indeed. We have a question from Facebook from Mongezi Tulelo, who's asking, what are the risks for a person with HIV and on medication on contracting COVID-19? Can you think of how we can describe that?
Yeah, and I think it's going to be dependent on where you live too. And as I was mentioning, what we see from Africa, Southern Africa in particular, that data may not be the same where you're living. Like I mentioned before, the best thing for you to do is to have your antiretroviral therapy on board, that you're taking them daily, that your viral load is suppressed, and that you're staying and doing all the right things in terms of avoiding contact with COVID. Hand hygiene, physical distancing, mask as appropriate.
Thank you. We're getting some questions on how WHO works with partners around the world on this issue. Could you talk a little bit about our work with communities, for example, and associations of people living with HIV/AIDS?
Yes, WHO, and especially in the HIV department, we have a really long history of working with what we call civil society in general. And that could be people who are living with HIV, people affected by HIV, networks of people who are at risk of HIV. And I think in many ways, we have lots of examples where we're working with civil society. We have a special advisory group of women living with HIV who have helped us through some of the most difficult questions about using dolutegravir and women who could have children. We have a civil society reference groups that provides us input on our strategies. And also we have a civil society members who join all of our guidelines processes, because whenever we make recommendations, we have to look at the science, but we and if our recommendations are feasible, acceptable, and can be easily implemented. And the only way we can know that is if we have people who are affected by the disease there at the table helping us make the decisions. And I think this model is now being tried to be transported into the world of COVID, where we know civil society needs to be at the table in terms of discussion. How do we move forward with vaccines, with treatments, with testing? Because without community understanding and support and translation of sometimes our very technical information, we will not be able to do what we need to do. And we've seen that with HIV, we've seen it with TB, we've seen it with Ebola. And again, we have to relearn these lessons for COVID as well.
Indeed, indeed. So we would love to thank everyone who's been joining us. We really do appreciate your time, Dr. Doherty. I'm wondering if just you could give us some last words, what your thoughts are as this meeting's winding up and on this important subject for us, please.
Yeah, no, thank you so much for having us here. I think what's so important to know is that we're facing a new pandemic, and that's making us panic. And we're really working hard, but we can't neglect the other essential health services. If we throw all of our energy into COVID, we're going to see 5 years from now that we're going to have more deaths because of the essential health services that we let go during this period of time. So we have to manage somehow to balance the two, not have a panic neglect cycle, but really work together to ensure that the critical services continue and that healthcare workers know how to manage the both, and how we can sort of see through primary care, through a universal healthcare sort of platform, that we're able to manage both of these and be able to move forward. And I just have to say the work with HIV is not done. And if we forget it now, we're going to be back in 2002, and we don't want to go back there where people were dying at age 40, 30 from an HIV, from a disease that we can treat. So we need to ensure that we get that job done.
Thank you so much. We've had people from around the world joining us today, from India, from Thailand, from USA, from the UK, from France, Germany, Indonesia, Singapore, Ghana, Nigeria, Cameroon, Tunisia, Malaysia, Argentina, Mexico, Spain, Italy, Morocco, Turkey, Nepal, Bangladesh, Pakistan, and I'm sure right here in Switzerland too. We really appreciate everyone's questions and their participation today. Thank you so much for sharing your stories with us, and thank you for your thoughts. Dr. Doherty, if people want to learn more about WHO's work with HIV and in terms of COVID, but also in terms generally of our work, where can they find more information?
Well, certainly if you go to the WHO website and type WHO HIV and you get to the face page, you will find information about what we brought to the meeting here. You will find all the statistics, but also we have a link, I hope, on the COVID page too, where it says, what about HIV and COVID? And some frequently asked questions. So there's a couple of places. So I hope you can find it. And if not, I guess I leave it to my comms teams here to send out some links so you can find it.
Thank you so much. And thank you, everyone. If you put questions in the comments from this point on, our experts will get back to you as soon as we can. And we look forward to everyone joining us for another Facebook Live or social media live coming up soon. So my name is Chris Black, Communications Department at the World Health Organization, Geneva. We're joined today by Dr. Meg Doherty, who's the Director of the Global HIV Hepatitis STI Programs at WHO. Thank you so much, Dr. Doherty, for your time today. Thank you, everyone, for your participation and for using our new technology today. So I'm going to see if I can stop it, and hopefully it will stop okay. But over and out from here.
Thank you.
And please join us again soon for another live from WHO.
Bye-bye. Thank you.